Up next, Authentically Detroit welcomes Sheba Rogers, Senior Program Manager at the Detroit Justice Center, Liz Kennedy, Policy Advocate at the Detroit Justice Center, Ali Lakhani, System Clinical Program Manager at Henry Ford Health's Trauma Recovery Center, and Valerie Kelly-Bonner, Executive Director and Founder of Strategies to Overcome Obstacles and Avoid Recidivism, to discuss a series of mental health roundtables they've been hosting around the city. And of course, we're going to talk about what we're reading this week from the Michigan Chronicle. Wes Moore is in Detroit. He's stumping for Jocelyn Benson's gubernatorial campaign. Keep it locked. Authentically Detroit starts after these messages.
Listen up, everyone. The 2026 Eastside Community Candidate Forum takes place at the Stoudemire on July 18th from 10 a.m. to 4 p.m. Join us on the 18th at this forum held in partnership with SEIU Michigan and hear directly from candidates in the U.S. House, State House, and State Senate elections about the issues shaping Detroit's East Side. This forum is the perfect opportunity for residents to ask questions about healthcare, development, preemption, governance, affordability, and other issues that impact our city's East Side. For more details and to register, visit authentically-detroit.com.
What's up, Detroit? Welcome to another episode of Authentically Detroit. Today we're broadcasting live from StreamYard. I'm inside ECN where it's cool. If you are in need of a cool place, your house is 100 degrees this week, come on by. I am Sam Robinson.
And I'm Donna Givens-Davidson.
We want to thank you guys so much for listening in and supporting our efforts to build a platform of authentic voices for real people here in the city of Detroit. We want you to like, rate, and subscribe to our podcast on all platforms. Today, we welcome Sheba Rogers. She's the Senior Program Manager at the Detroit Justice Center. Liz Kennedy is the Policy Advocate Director at the Detroit Justice Center. Ali Lakhani is the System Clinical Program Manager at Henry Ford's Health Trauma Recovery Center. And Valerie Kelly-Bonner is the Executive Director and Founder of Strategies to Overcome Obstacles and Avoid Recidivism. They're here to discuss a series of mental health roundtable conversations that they've hosted across this city. Trauma, it is often thought of as an injury resulting from a crash, an accident, a gunshot wound. However, we know that trauma it can be any event resulting in physical, emotional, or life-threatening harm that has lasting adverse effects on an individual. After a violent crime, some survivors may experience lasting negative effects impacting their mental health. The Trauma Recovery Center is working to promote resiliency and holistic recovery for survivors following a crime. Their mission is to maximize the efforts of traumatically injured patients, families, and communities through support, mental health services, education, and access to resources. Since its founding in 2005, SOAR has been committed to enhancing the lives of those in need throughout the Metro Detroit area. Their dedicated staff and volunteers come from diverse backgrounds, bringing in expertise and compassion, striving to create lasting positive change. They measure success not just through data, but through the stories, what they're hearing, the visible improvements in community well-being. In today's world, substance use, prevention and harm reduction are essential components of well-being and community health. SOAR uses a holistic approach, offering education support and engagement to encourage and promote healthier behaviors, reduce harms, and build stronger, more resilient communities. The Detroit Justice Center, which my peers have heard all about, is a nonprofit law firm and advocacy organization working to create just cities where every life is valued and supported with dignity and care. It is a national organization rooted in Detroit, a city emblematic of both the harms of racial capitalism and the resilience of community-led solutions. They engage in legal, policy, and narrative work to inspire the work of building just cities across the nation. Sheba, Liz, Ali, and Valerie, how are you guys doing?
Thanks, Sam. That was great. All is
Great.
well. Feeling good.
Well, I'm excited to have you guys on.
Thanks for having us.
The trauma conversation is so timely. Is something that means a lot to me. You talked about trauma. I want to start by really talk about what trauma is, because I always thought of trauma as something that happened to an individual, and increasingly understand that it happens on an intergenerational level. In fact, many of us have trauma passed down from the time that our ancestors were enslaved until now. And if it's not healed in a generation, then the trauma responses become the actions of another generation until we intervene. And then you have, in addition to that, a parent who's incarcerated, a child taken for foster care, and on top of that, violence. So we talk about all of that, the cumulative trauma that we see inside of our community, and how that cumulative trauma relates to some of the symptoms we may see, like violence and substance abuse and other things.
Yeah, absolutely, Donna. You're 100% correct in the way you presented that. So we have different types of traumas and different levels of traumas. And one of the ones that you mentioned was historical trauma, which is pretty well known. It's something that can be passed on from generation to generation. And what's really interesting about that is there's this topic of epigenetics, where it basically looks at a person's genes, and they can see those genes and how they're expressed differently based on the trauma that someone's experienced in their lifetime. So it really is something that gets passed down from generation to generation. And then you mentioned earlier as well some of the things that may happen in early childhood. And so that's what we refer to as adverse childhood experiences, where someone who has experienced some of these negative experiences or even environments from the age of 0 to 17 as they're growing, it can have long-term lasting effects later on in life. And this was a landmark study that was done back in the early 2000s out of California, where they looked at some 17,000 people, and they asked them, what types of experiences did you have from the years of 0 to 17? And then they did a longitudinal study to see what their health outcomes were like later on in life. And so they linked some of those, what they refer to as ACEs, to things like heart disease, cancers, mental health challenges, and even what they refer to as risky behaviors. They also found that those who had higher ACEs scores were actually more likely to be involved in some kind of victimization or with the justice system. And so, it's something that can be passed down from generation to generation, and then you can see the impacts, and you can actually measure those impacts throughout life and even at a community level.
So I am a poster child for what Ali just described. I am an ACEs trainer, but I've also done my own research on myself. And you can get an ACE score as high as 10. My score is 7. And my mother got pregnant with me as a senior in high school in the middle of the civil rights movement in Birmingham, Alabama. So she's leaving her house, seeing lynches, smelling burnt skin, segregated water fountains and all of that stuff while I'm in gestation. Very long story short, I have a high intellect because I graduated high school with her. So she was in her senior year. She's reading and doing all of these other things, but I also have anxiety. And in comparison to my brother, who was not born out of a teen pregnancy, she was married when she had him, more stable, did not have to experience all of those things. He does not have anxiety or any other mental health disorder. So I really, really and truly am a poster child for that. And we have created a film about me and my ACEs story.
Where can we find that film? That sounds really
Well, actually, you can premiere it if you want. I do. Yeah, we haven't actually premiered it. It's called Sister Heal. It's Time to Keep It Real. And it's the story of myself and Trisha Duckworth, who was a preacher's kid, and how that impacted her life. But it's our story surrounding ACEs. And, what made us who we are today and how we deal with that trauma associated with those adverse childhood experiences, including molestation. All of those things happen. So we kind of talk about them and, explore them a little bit in the film. So we would love it if you would like to host a screening of the film.
Don't even worry. It's not an if, it's when.
Okay.
We're going to do it. It's something I'm so passionate about. I mean, we talk about young people. We know all these things, right? And they're like, oh, kids are acting up. Let's call the police. Kids are acting up. Let's, strict discipline. Healing is never the first response to seeing hurting children when they're Black. Now, if white kid shoots up a school, we want to know all about his adverse childhood experiences because there's got to be an explanation. It can't be that, you know what I mean? But when it's us, we just live through stuff and we show the harm. I'm fascinated. Sheba, I think you also have something to say about this. I'm not certain.
Absolutely. Wow, we're really hitting on why this work is really personal for each of us, honestly. And so I think the roundtable and the work that we're doing with the mental health roundtable really speaks to why we really have come together, not just as professionals in the field, but as Detroiters, as loved ones who have been both directly impacted as well as have, supported family members who have been directly impacted by great trauma. I know myself, I've also experienced that and have, written of some of that in some of our op-eds. But what has really been the catalyst to bringing this roundtable together is really creating space where we can be collaborative and not siloed. When DJC started our mental health ecosystem and landscape analysis back in 2022, we began conducting a series of research interviews and partner interviews with Detroiters working around the topics of mental health, substance use, and harm reduction, because we know a lot of trauma is reflected in behavioral health, substance use, and harm reduction. And so that scan really pointed to how much some of our providers were really seeking to get more connected. And to have a space where we can build power around responses, non-carceral responses to care, right? So many of us have experienced trauma, whether in our homes or in the community, right? Just being in Detroit and looking for responses that are centered on truly being informed, right? Trauma-informed care, as Ali was just leading into. And so that's a little bit of the work that we do with the roundtable. We've been collaborating with dozens, right, of community partners, grassroots leaders to host the roundtable discussions and really thinking about the state of mental wellness in Detroit. We really feel like it's not talked about as much as it needs to be talked about. It's referenced, but then when it comes to solutions, the solutions are not as robust and comprehensive as they need to be. The funding is not as robust and comprehensive as it needs to be. And we think of it as both a public health and a violence intervention work, right? That's how we see mental health, right? And so what we've learned from the ecosystem scan that we conducted is that Detroit is greatly under-resourced. And we face unique challenges as a predominantly Black city. And so particularly when it comes to talking about substance use and harm reduction, we need to just shine a greater spotlight on it. We know that Black and Brown communities are over-policed and the criminalization is not new. And so if we prioritize seeing substance use as a public health issue and not a criminal issue, we'd be investing more into treatment than in incarceration. So that's really the frame that we approach the work in. So I don't know if you all are aware, and I believe you are because you're, always bringing just wonderful information through this podcast. But Detroit is currently spending $455 million on policing and only $55 million on health. And that comes from the general fund budget. And so what would happen if we flip those? Oh, go ahead. Yes.
I agree. I feel so strongly about that. We see people and there's just a lack of empathy, a lack of compassion, a lot of realness. Okay. Because I don't know anybody who does not have trauma, right? We all have trauma. We all have now. We're not all at 7. Some of us are 8s or 9s. Some of us are at 3s, but we all have trauma and we know it. And yet we minimize it when it comes to public policy. And Liz, that's your job, to be the advocate for public policy. What are you saying when you try to speak on this?
Yeah.
Yes, that's a great question. Well, my job in a policy role is to uplift and amplify the perspectives, the leadership, and the solutions that our communities already have on the ground, that Valerie already has, and the incredible harm reduction work she's doing in community, the type of solutions that Ali is piloting every single day at the hospital. So we're not coming up with anything new. We're just trying to bring amplification, resources, and build power around, the solutions that our communities already know that we need. And a big part of what we do is really trying to reimagine systemic scarcity, systemic disinvestment in terms of mental health. So as Sheba shared, what if we flip that? What if we spent, instead of $455 million on policing and only $55 million on health, what would happen if we flip those? What would happen if our elders had access to healthy and thriving healthcare? What would happen if we actually had access to the type of affordable housing that we know actually keeps us safe? And in Detroit, we have approximately 211 licensed inpatient psychiatric beds, but over 2,000 adult beds in the county jail. So what we see from a policy perspective is that Detroit, like every other city in America, has turned to mass incarceration and the prison industrial complex as our main tool for responding to the mental health crisis in this country. And, there's a quote by Angela Davis that I love, and she says, "Prisons don't disappear social issues, they disappear human beings." So if jail and prisons are our most robust response to the mental health crisis, to the opioid crisis, the substance use crisis in this country, we're not actually helping people get rehabilitated. We're not actually helping people meet their basic needs, and we're certainly not creating public health or public safety. So a lot of the work that we do in the roundtable is to try to figure out, okay, what can we advocate for that is actually going to shift the systemic conditions that lead to so many Detroiters, especially those who are Black, brown, trans, LGBTQIA, who are living with disabilities, already living with behavioral health challenges, living with opioid or substance use disorder. How can we really make sure that they aren't falling through the cracks and have the resources that they need? So we do a lot of narrative change work. That's really big. Stigma is something that if you join our roundtable, you will hear us talk about stigma all the time, because stigma is fatal. When we perpetuate stigma, it leads to discrimination, and it creates a lot of harmful barriers to folks who are really in need of care. So, we recommend trainings and assessments to help really erode, the type of stigma that holds people back from getting the care that we need. We also advocate for low barrier services in all levels of care. That's super important. Right now in the city of Detroit, there's all types of eligibility requirements at shelters and hospitals. There's lengthy paperwork and intake processes. Sobriety requirements is one of the main barriers that we argue against. You shouldn't have to be sober to care. So those are the type of policies and shifts in narrative that I advocate.
Yeah, a couple of things about narrative and also just educating people. We decided to invest in mental health first aid at our organization, and I found the process of the training to be more stigmatizing than, because we were talking about those people. Nobody ever gets up and does these trainings and says, listen, this is when my bout of depression, this is when I struggle with whatever it is because there's no such thing, at least I don't believe, in perfect mental health. We all have our struggles, and sometimes they last longer, but there's nobody, again, I just think that when we connect ourselves to these things, it makes it easier for us to make good policy decisions when we can see ourselves and the people we are trying to impact. But a lot of times we do that social distancing kind of thing. I have this lyric that always plays in my head, and I'm kind of embarrassed because it is Kanye West. But this lyric, drug dealer by Jordan, crackhead by crack, and the white man get paid off all of that. Because when we talk about the prison industrial complex, we also have to acknowledge the fact that it is really lucrative for certain people. This is a prison industrial complex where people are making money on prison industries. And so we don't always examine the the profit motive behind the dehumanization that exists in 2026 that is not that dissimilar to the profit motives that surrounded the dehumanization in 1776. It just feels as though we shift titles and names and all that kind of stuff. I was watching Queen Sugar again, and in that first season, how Nova was exposing how young black men were being imprisoned for things and not treated. And so I wonder how we take back the truth. How do we begin to really, quit pretending like this is somebody else's problem and we don't have it in ourselves and our own families? And B, how do we also expose some of the reasons for some of this injustice that have nothing to do with narrative and understanding and everything to do with somebody's getting rich off of all of that? Anybody want to take a shot at those two weird questions of mine? Billy, I think you're tweaking and you are, okay, good, there you go.
So I'll take a shot at it. First of all, Black and brown communities have to realize nobody's coming to save us. We have to save ourselves. And the resources that they do come to provide, maybe such as SNAP benefits and some of those other things, that's not really saving us. That's another part of keeping us oppressed. Not that they don't help, but what you have to go through to receive those things, it's ridiculous. So we need to realize no one's coming to save us. We have to save ourselves. And how do we save ourselves? The people who we put in position to sit at tables, they can't bring scraps back to the community. We also have to educate the community to realize that people who are in positions, whether they're elected officials, your school board president, or whatever, they work for us. Those are public officials. Even our judges and our police officers, they're using our tax dollars to live their lives. That's where their paychecks come from. But we get it twisted. We sometimes, I think, bow down too much to that instead of really.
But I want to interrogate that thing about they're not coming to save us. When people colonized Africa, they didn't bring bullets first. They brought Bibles and gifts. And those gifts and Bibles are designed to pacify us. To what extent are they not only not coming to save us, but also to some extent people are coming with Trojan horse gifts, where I'm going to come and bring you something that is actually designed to exploit you or harm you? I don't think it's just not saving us. I think there is a matter of policing containing us, policing being used to restrict us and to protect other people, because really saving the people who you value. And there's a dehumanization of the people like us and the people that we're all trying to include in that process. And part of the way that we approach mental health is that dehumanization. Some of the seeds, what's the term drapetomania? Anybody remember what that is? Drapetomania was the disease of an enslaved person trying to get free. There was actually a diagnosis of drapetomania if you were trying to escape slavery. So can we, because I don't think that it's just that they're not doing a good enough job or they're not trying hard enough. I believe that sometimes systems are designed to entrap us and we're not acknowledging that. I don't know, especially mental health systems.
And I think that's really why the work that we're doing through the roundtable at the DJC is so important, because that's what we're hoping to reimagine, taking these cares and these levels of care out of the system and putting it back in the community and putting it back in those areas that people are part of. Oftentimes we like to, I feel like in mental health and behavioral health circles, there is this desire to diagnose everything when not everything needs to be diagnosed, and really turning back to the community level solutions. And our elders and our ancestors, they had ways that they navigated these challenges and these issues. And so rather than going outside of that, going back to those ancestral ways and going back to the way that the communities operated and building that community again, so that the community is there to support one another during those times of challenge, rather than leaning on these external systems and, to Valerie's point, waiting for someone to save us, but really shifting that strength back to the community.
Mm-hmm.
If I could just jump in there. Oh, you kind of got juicy with that question. I mean, that took me somewhere. Because Detroit is a place where so much is birthed here, right? Detroit is like the Mecca, right, for our nation. And so much is happening here. So many movements are happening here. So you're really kind of speaking of, things, Donna, when you ask sort of like, are we looking at all the ways these things are happening and, being, the ways that we're being, sometimes complicit, or maybe, things are kind of going over our heads, in some ways. But I think, as Ali just brought up, this is what we're trying to reimagine with the roundtable, and not to go too deep, but one of the things that I think I have done here in this seat and in helping to convene the roundtable is we have to bring our privilege into the various spaces that we're in, right? And so I'm from the east side of Detroit, but I also have, both of my parents have, experienced incarceration and are presently incarcerated. Several members of my family are struggling with substance use disorder and housing instability and mental illness, right? And so as a loved one who's very close, I get to be at the table and be that advocate, right? And each of us, right, whether we have a parent, a child, a sibling, a family member, that is our ask. For those in the roundtable, come, there is a place for you, right? Come, we have a responsibility to be at the table, to advocate, to push these policies, to get in the door. I can get at some of the tables and in the door, various privileges and my educational background and so on and so forth. But when I get in the door, it is to raise awareness, of some of these issues that, again, we're just, not really talking about, sweeping under the rug, right? So I think it definitely takes courage for our partners to come into the space. And sometimes our partners come in the space and they say, you know what? I haven't really talked about this. I haven't really, been in a space where I can really do something about this. It's just something we are all kind of navigating personally in our families because of, what Valerie shared, the stigma and different things. But now as a roundtable, we're saying, no, we're not going to let the stigma, we're not going to let the narrative kind of keep us siloed. We're going to come together. We're going to build power. We're going to build movement, because that's what we've always done in Detroit. And we're going to shift this. How are we going to do that?
Build health, right? We're going to build collective health and wellness. We're going to take care of all the
We have to do it together.
Also saying is that we're not going to leave it to systems that don't love us to treat us. To diagnose us, because that's my biggest issue is I believe mental health treatment is needed, but I think people who don't love you are not going to give you an accurate diagnosis or treatment. Whether you look at special education and the ways that Black boys are treated one way and white kids are treated another way, under identification of certain disorders and over identification of behavioral disorders in Black males, because of this. And so it's like, okay, special ed is meant to be good, but when it's used to marginalize our children, when it's used to warehouse them, it's not a good thing. And again, I'm not a conspiracy theorist, but you don't have to be a conspiracy theorist to understand that prisoners are not freed by the 13th Amendment, and they're producing so much wealth for some people. And so, at some point, turn those dots and say, wait a minute, we don't have for-profit prisons. We have, the prison telephones that cost too much. We have all these other systems that extract our wealth, and our systems are extractive, and even policing can be extractive, whether the police are taking your stuff without a hearing, because asset forfeiture or other mechanisms that policing is extractive. I think what I love about Detroit Justice Center is Detroit Justice Center fights that good fight. Detroit Justice Center was willing to ask the hard questions. And one of my questions is, how do we liberate mental health responses from the mental health complex that's connected to all of these other oppressors. And that might be too much for now, but I hope in the roundtable, those are the conversations I want to have.
Oh, that's right. That's good. That's good. That's right on point. Like, please join us. Please join us. Like, that is right on point with what we're talking about, with what we're trying to do, like really getting into the root causes of harm, right? What we see across the city is we're really kind of still at the surface level when we talk about addressing harm and substance use. We're not getting to the root causes. And so this conversation is so inviting into the fact that there are some systemic barriers and issues that are, decades, centuries, right, long, that we're competing against. And so we have to keep that at the forefront. And I appreciate that, Donna.
I mean, look at foster care and look at the impact of foster care on families. And look at who gets taken and why, right?
Yes.
Our kids are overrepresented in foster care. It causes a harm. If we invested in families to try to heal families, some kids need to be removed. But sometimes if you can keep them together, let's do that. Look at what happens when you take a parent and you put that parent in prison. Look what happens to the children who get left behind. And then the parent comes home and his family is, not going to be the same once that parent comes home. And I think these are things that are happening in our community. And then it shows up in our children who are hurting. Not because they're bad, not because there's something broken about them, but because our system is not designed to promote their physical and mental health. Yeah. Valerie, you were number 7. You got number 7. You scored that, but you're doing well now.
Yes. But it took a long way. It took a lot for me to get there. And I'm not doing well because someone discovered this was my issue, right? It came through me educating myself, going through corporate America. I was a scientist before, and then bringing up things in that atmosphere. And people were judging me. And it's like, I'm not an angry Black woman. I'm just speaking up for myself, because for so long my voice was silenced and I wasn't able to speak up for myself. My mother often questioned, like, why didn't you tell me some of the things that were going on? And it's like, Mom, you never opened that door. It was like what goes on in this house stays in this house. So that door wasn't open, not only for me to come to you, to go to another trusted adult to say anything, because you put the fear of death in me if I said one word about anything that went on in this house. So, and I get her silence because her grandfather was a sharecropper. She's not that removed from slavery. So my great-grandfather is a sharecropper, right? So I'm not that far removed from slavery. So it took a lot of, when I had my first agoraphobic panic attack just out of nowhere, it took a lot for me to understand why I could no longer control myself, because I'm a type A personality, and like, why can't I get control of this? And so I had to explore all of those things. And that took me all the way back to an incident that happened when I was 5 years old, where the trauma began, where the behaviors began, where the boundaries were too stringent, where my voice was silenced. It took me way back. And 7 is a high number. I'm surprised that I am not, I have used drugs as a part of masking my feelings and trying to feel better. When you don't care what else is going on around you until you sober up, right? And I just feel like I'm surprised that nothing worse happened to me than what did. Because of the situations that I was in, I could have been in a lot worse situation. So I'm just thankful and grateful that my awareness came when it did, that I sought the help. But they tried to over-medicate me. So, we can talk about all of that. They tried to over-medicate me.
Talk about that. Let's talk about them trying to over-medicate you. What were they trying to do?
So when I was diagnosed, so this was like 40 years ago. So it wasn't as common right now to say the word mental health, to say the word anxiety, to say the word depression. And so I was working and I was kind of standing up for myself there. I was hired for a double spin count, Black and female. in a white male dominated industry. So, there was a lot of pressures that were put on me in that environment because they hired me, but then expected me to be something that I wasn't. They expected me to be something other than a Black female. And it's like, I'm not that, so this is what you hired. This is what you get, but I'm still intellectually capable and educated enough to do this job. And so when I finally had my panic attack, I went to the hospital. I had palpitations going on and everything. And so they thought I had a heart attack because we wasn't as far advanced as we are now. And they put me in the room and put these monitors on me, and was trying to see if I had a heart attack, because if you have a heart attack, you release a certain enzyme that they can detect the next day. Well, they said you didn't have a heart attack, but I was like, well, something's going on. I couldn't even stand for a clock to tick. I'm like, something is going on. And so they were like, well, we'll just put you on some medication. The medication was so strong. All I could do was just sleep. And because I was stressed out, didn't understand what was going on, couldn't work, couldn't hardly do any of my normal day-to-day functions, I was just taking the medication as directed. And my mother finally said, you look like a zombie. Like, stop taking that medicine. She was like, stop taking that medicine. Just pray. I said, Mama, praying ain't working. So that's another thing we got to stop saying, too. Faith without work is dead. So all the preachers, my father is a preacher, and everybody's coming in praying. Put those Bibles down, because when y'all go home, I'm still nervous as hell. And I can't sleep. None of that is working, right? And then when I take the medicine, I'm dysfunctional. So I had to find a happy medium with the medication. I do take medication for my anxiety, but I had to decide what dosage is right. And I think sometimes we don't get involved enough in our healthcare. We just take what they give us. And it's like, no, this is my body. This is too strong. Like, I only need to take this amount, or I have conversations with them about what my healthcare looks like. We are partners in this because this is my body. I'm not just doing whatever you tell me to do. I would have been addicted to those pills if my mother hadn't pulled me off. I would have been addicted, because that's how strong the prescription was. It was too much. And when I cut them not in half, in quarters, and took 1/4 of the dosage of what they were giving me, I was okay. That's all it took. So we have to be careful about that, too. And now we flip the script, because with the opioid crisis or whatever, now you need an opioid and they tell you to take a Tylenol and go home. Like,
oh, but if you read the story of the Sackler family and the opioid crisis, and the way they manipulated the FDA, and the way they misled people about test results, and the tens of millions of people who got addicted to those drugs, and the way they targeted some communities, there was definitely exploitation. The biggest drug dealers in America. And before that, they did Valium. And then the system overcorrects to make it difficult for people who need pain relief. But the reality is that the harm that was done, how many millions of people died early because of what they did, and nobody went to prison. Nobody got locked up. Nobody was really held accountable. And now we pay for it and not being able to get pain relief. And that's the challenge. Again, this pharmaceutical industry, it's going to sound like I believe that big business and corporations exploit people and extract our wealth and well-being. And it's probably because I think so. And so your example is, how many kids do we have drugged inside of school because they were, diagnosed with ADHD, and then they're not learning and they are being passed along. And so what I love about this, bringing it back to the work that you're doing, Ali, and I know you have to go in a minute, bringing it back to the work that you're doing as a clinician, you are bringing a different kind of approach that is focused on trauma and healing. Can you talk about how that is different from this medical industrial complex and all these complexes I keep talking about?
Yeah, absolutely. And really, we're proud of what we've built at Henry Ford and what we're continuing to build. It's part of a national model of the Trauma Recovery Center. And it's based around 11 core elements, the primary of which is ensuring that we have access to all survivors of crime, not just those that maybe look like us or that have a certain type of insurance or that have a certain type of legal status, but really ensuring that these services are open to all survivors and that they're accessible and that there are no barriers to that access. And then a lot of what we do at the Trauma Recovery Center as well includes education. And to your point about health literacy and the challenges of ensuring that you are a partner in that and you're able to stand up for yourself and have those conversations and ask questions and not feel a certain type of way when asking those questions. So that's a lot of the education that we do. And it's education around trauma, education around health, education around speaking up for yourself when you have certain questions around your health. And it's not just about ensuring that we have like, hey, we're going to follow this protocolized method to treat the mental health condition that you have, but it's more so, okay, how can we partner together and how can we ensure that your goals are at the center of what we're doing? Your goals and your future is at the center and how we proceed with treatment and whatever that treatment may look like. And it's going beyond that because as we know, if we just treat, say, the anxiety disorder that this person is experiencing, what about all of the other challenges outside of that? So, for example, not being able to get to an appointment or having to find childcare or having to worry about where the next where the money is going to come from to pay for your utility bills. So it's not just about treating the medical, quote unquote, medical condition, but also all of the surrounding determinants of health that are impacting that. And so some things that we offer include coordinated case management for our survivors. We offer free Lyft transportation for all of our survivors to and from appointments, and not just Trauma Recovery Center appointments, but even other appointments. And really meeting survivors where they are. We can also come out and meet you in the home or meet you at a third location that's best for you. So really, it's all about meeting survivors where they are and being able to ensure that the treatment looks like what is best for that survivor, and it's not just this protocolized thing that looks the same for everyone.
So Liz, you were kind of breaking up and you had to drop out for a minute, but you were going to talk about advocacy and, legal advocacy. Where do you see progress being made right now in these fronts, and where do you see more need for improvement?
That's a great question. So we're certainly seeing some major improvements with Sheffield's administration. Detroit's own community health assessment is telling us what residents are asking for and what community members like us here, those at DJC, have been advocating for years. We're naming mental health, affordable health care, access to grocery stores, maternal and infant health, housing and stable housing, transportation. These are all some of the major public health needs that Detroiters have named in the city's own community health assessment. And the city is starting to take seriously that this is public health infrastructure. These social determinants of health that Ali is naming. And this is also a public safety agenda. If we want fewer crises, fewer 911 calls, and fewer jail bookings, then we have to invest upstream into the resources and the safety infrastructure and the health infrastructure that's actually going to keep Detroiters safe. So for us right now at DJC, we're very invested in making sure that we increase access to harm reduction resources across the city. We're also advocating, as I mentioned prior, to eliminate barriers to housing, barriers to treatment and care. Oftentimes, we talked about stigma. Treatment can be very limited depending on someone's sobriety, depending on whether someone is housed, whether someone is disabled or living with a behavioral health condition. And we want to see all of those barriers gone, right? No one should have to be sober in order to access care. We're also very interested in divesting from the police budget. Ultimately, the reason why Detroit has historic low crime rates is not because of our massive, almost $500 million DPD budget. It's because of ARPA funding. It's because of community violence intervention. It's because of the amazing work that Ali is doing, the amazing work that Valerie is doing, the amazing work that DJC is doing. It's because of organizations like the Detroit Black Security Food Network that's offering free, accessible, affordable, healthy, nutritious food to Detroiters at scale. So these are the resources that actually keep us safe, and that's what we advocate and invest in. And we also are excited to hopefully invest and support a non-police crisis response program here in Detroit as well. It's very important for us to see that policing and criminal Is completely divorced from any type of overdose response, any type of crisis response. And Detroit is actually, we're lagging behind in the national movement to really divest crisis response from policing. So the more we can invest in public safety and public health infrastructure that actually keeps us safe, healthcare, housing, food access, this is what's going to keep us safe long term and healthy, not an increasingly expanding police budget.
Yeah, I think go ahead, Donna.
No, go on.
I was going to say, I think that's a good time to segue into our next segment. We're going to take a break. And when we come back, we're going to be talking about this week's top headlines. We want to thank Liz Kennedy, Sheba Rogers, Valerie Kelly-Bonner, Ali Lakhani. Thank you guys so much for joining us on Authentically Detroit. We are trying to create a space for real people, real voices, and you guys are definitely some real voices. So thank you so much.
Thank you.
Thanks, Donna. Thanks, Sam. Thanks for having us.
Thank you.
Yeah,
Thank you
of
for
course,
having
guys.
us.
So good.
Yeah,
Thanks so
I think so
much.
too.
I'm feeling
I look
like
forward
we
to
need
joining
a
your
part two.
conversation.
We might
Yes,
need a
I
part
definitely
two.
want.
This was so good. I
Absolutely.
have just so many more notes we didn't even get to. So
I know, right?
Make sure that we have a follow up and we talk about connecting our work and having this here. I absolutely want to screen your documentary, Valerie. I cannot wait to see it and invite people to our community center to your story. I really appreciate all of you. And Ali, thank you for your work and Henry Ford, which is one of our health partners. We actually operate an infant center that Henry Ford donated to us. So we really appreciate that partnership and also the work that you're doing. Liz, keep on fighting the good fight. And Sheba, thank you for your work as well. This is great.
Absolutely. Thank you all. Peace.
Thank you all. Take care.
Alrighty.
Thanks, y'all. Appreciate it.
Thank you.
Interested in renting space for corporate events, meetings, conferences, social events, or resource fairs? The Stoudemire Wellness Hub and Mac Market are available for rental by members, residents, businesses, and organizations. We offer rentals for activities such as corporate events, social events, meetings, conferences, art classes, fitness classes, and more. To learn more about our rentals and reserve space, visit ecn-detroit.org/space rental.
Welcome back, everyone. We're going to run down one of this week's top headlines in the city of Detroit. On Monday, Maryland Governor Wes Moore came to stump for Jocelyn Benson's gubernatorial campaign. He talked about how the Democrats need to disrupt the status quo. He was asked by Clara Hendrickson, she's a Free Press reporter, about the state of the Democratic Party. He reiterated again that he does not speak for the Democratic Party. However, he sort of echoed statements that got called out by a member of the squad. AOC was kind of sideswiped Slotkin for saying that perhaps there needs to be some new House leadership. The Congressional Black Caucus came after Alyssa Slotkin for saying that. But it is interesting, Donna, that some of the sort of more cozy to establishment, moderate corporate figures within the Democratic Party are mimicking the messaging, but sort of halfway, or maybe not even half. I'm hearing affordability. I'm hearing, we need perhaps new leaders and changing the status quo. I don't know if that's what voters are asking for. I think a lot of the people that I talk to want Democratic Party leaders to change their values that reflect a working class. And so I don't know if we heard that from Wes Moore. I'll have to go back in my notes. However,
the change is not going to come. Changes. I don't think the change is going to come because Wes Moore changes, right?
He's going to be one of the presidential,
He is. But I think the change is going to come because people who are progressive have more power. And therefore, the party changes. Most politicians will adapt as change, you know what I mean? But I don't think we're going to look for a change in conscience as much as a change in reality. That the old processes, like you said, the values, old values, Hakeem Jeffries came out and, reaffirmed his commitment to Israel as a state. And, that's not something that is going to be universally accepted by people. Certainly not when he's not reaffirming his commitment to Palestine as a state. You know what I mean? It's like there's this feeling, there's a disconnect. And I think it's generational.
It's interesting when you talk to people like Wes Moore, who will say, I wasn't a career politician. I didn't expect to get into politics like this. He really is kind of like the exemplary Black man archetype, right? Like he's just so well-spoken, good-looking guy, young, energetic, upbeat. And I told him, I was like, you seem very relatable. I see why Maryland elected you governor. What does this mean to you? And he talks about, coming with the historical significance of his position as the only Black governor in the U.S. He's the third, right? I mean, that's when we talk about Garland Gilchrist or even John James, there's only been 3 Black governors in the history of our country. And so Wes Moore is one of them. He was at Morningside Cafe right on East Warren.
Shout out East Side.
Yeah, shout out Jeff. Definitely got his picture with Governor Moore. Charity Dean is the director, founder of the Michigan Small Business Alliance. And she was there as well, talking about how to uplift small businesses. Chris Scott sort of was the fill-in for Benson, who interestingly was not at this event. Don't know what that was about, but we got to talk to Wes Moore. He's the second governor that is not our own governor that has been to Michigan in the past few months. You remember during the Democratic primary, Andy Beshear was here as well. I got to talk to Andy Beshear for a little bit too. I just talked to Wes Moore this afternoon on the phone. You can read that Tuesday morning on Michigan Chronicle. Donna, these folks are obsessed with our with Michigan, right? We are such a main character, and Benson getting the support from Wes Moore sort of adds another. He said, "I'm 1,000% behind Benson." Gives her another sort of, look, this Black leader likes me. I asked Wes Moore, who are the Black leaders of America right now? I mean, are you not like the central figure? He did not really answer my question. However, he talked about the coalition that he's trying to build. He's talking about building unity between progressive and the more moderate Black establishment wing of the party. People have done it. Garland Gilchrist has tried to do that. Donovan McKinney has tried to do that.
Donovan McKinney has done that. I think when he ran for the state house, he did that effectively in his district. I think he's one of the young Black politicians who's been able to demonstrate his ability to cross, geographic lines.
Yes. And so when you talk about a guy like Wes Moore, he is certainly more open about his positions without using without fully compromising himself to his donors, I guess you could say, or to the Democratic establishment. He's not going to, call for Schumer's resignation, but he is going to say that perhaps there needs to be changes to people who are looking for something new. They're looking for different. And so he's able to say stuff like that. It kind of reminds me of Shapiro, honestly.
If you look at Wes Moore is the governor of Maryland. Maryland is not like Michigan. Maryland is 29% Black compared to 13% in Michigan.
Right.
So that's a huge statistical difference, when you're really looking at the influence.
Right.
Because if he were theoretically to get a large, and, being Black, obviously John James being Black doesn't really matter to voters who are looking for somebody to represent their interests. But when you are Black and you represent their interest, the likelihood that you're going to get elected is much higher. I think the other thing about Maryland that's different from Michigan is two peninsula. you get up north and you're in this, northern peninsula. I can do this online now because we're on this thing. And you have really, these Republican strongholds in parts of it. Different. Maryland to me feels like it's mostly urban, suburban. Their state does not have as many, it's not many places that are just small conservative strongholds like Michigan does. Michigan is an interesting state. And so winning statewide in Michigan is hard because it's hard to have one messenger who's Black who appeals to people in all these different places.
Sure.
One of the areas. Go on.
He compared Detroit and Baltimore, two cities that are often compared. He compared the relationships that both cities have to their states, talking about the state takeover of Detroit, talked about the municipal financial crisis that Baltimore went through, the work that Democrats had to do in the state legislature to give power back to local leaders. And he said, with a mayor like Mary Sheffield, a dynamic mayor like Mary Sheffield is the language he used, and somebody like Jocelyn Benson, that work could be felt here. He has certainly seen a decrease in violent crime, as most major cities have. But he also talks about the redevelopment of the Inner Harbor. So Baltimore is sort of downtown. Very similarly to Detroit's downtown.
It's not. Baltimore is just. We went on a community development tour of Baltimore last year and learned a few things. Like the area median income is much higher in Baltimore than it is in Detroit. In Baltimore County, the pier in downtown. Baltimore does not have the same kind of Black representation in there. River communities. Detroit still. So it's different. The other thing is that Maryland is 44% white. Michigan is 72% white. Think about that difference between Hispanic, Asian, and Black people in Maryland. You have a majority of, underrepresented minority people voting. And in Baltimore is much more central to Maryland. So I think that there are similarities. I think there are differences. I think Jocelyn Benson is certainly aided by Westmore. I think he's a compelling new politician who seems to be able to navigate, like you said, these differences. But I think that it will be many years before someone like Garland Gilchrist will be able to have the kind of standing that Westmore has in the state of Maryland, just because of our racial composition and our geography really makes it difficult here. I was really shocked to find out that the median incomes, when we were in Baltimore, I was looking it up and I was like, oh my goodness, you guys have so much more money. Even their low-income communities are wealthier than Detroit. I was at a housing conference last week and they were talking about, having a community that has a median income of $37,000 impacts rental housing stability. And when you're in Detroit, you don't understand how we look different than the rest of the nation. So there's comparisons, but I think there are the kinds of differences that make it hard to really, be in the same place. I think Metro Detroit probably has more Black elites than Metro Baltimore.
Sure.
But a lot of our elites live outside the inner city. And in Baltimore, I don't know. I think Maryland might be a little different. But, you got the DMV right next to Baltimore. And, the influence of Washington, of D.C. and Virginia on Baltimore politics. It's a different place. Glad he came.
Yeah, me too. It was cool to see him at my coffee shop cafe right there on East Warren. Wes Moore is the governor of Maryland. He was here stumping for Jocelyn Benson, who is running against Chris Swanson. She is the front runner, and by a not close margin. Today, the Detroit Free Press endorsed Mallory McMurrow. Not a surprise if you know the people that decide endorsements at the Detroit Free Press.
When you say that, what do you mean? What do you mean?
I just mean they're all very friendly to McMurrow and wish her a happy anniversary and replied her tweets and will say things that are like questionable as a news reporter. So I don't know. I'm talking about one person actually, but yeah, that wasn't surprising to me.
McMurrow is the comfortable person for them, right?
She is sort of she's progressive, but she's also cozy with the people that people want to hate on. And I think an organization like the Detroit Free Press. It's funny, the News endorsed Swanson. Isn't that kind of funny? Right. I mean, if I was a Democratic candidate, I would use that. Like, I would say, look, the conservative Detroit News. Nevertheless,
the Detroit News wants John James to win, or whoever the Republican is. So
funny.
Of course, they're going to endorse the Democrat who has no chance of winning.
I think they've endorsed in both the primary. They endorsed the Republican primary candidate.
No, I understand. I'm saying that the Detroit News wants the Republican to win. And so the Detroit News is going to endorse the person who presents the least of threat to the Republican.
Sure. I think they know that their endorsement is not going to make Chris Swanson win this race between him and Jocelyn Benson. But the McMurrow endorsement, it was interesting today. People are pretty firm now that she appears in third place behind Haley Stevens and Abdul Al-Sayed, who feels firmly in first place. If you talk to perhaps our neighbors, perhaps it's the other way around, because people just have not been messaged like they have with Haley Stevens. Those ads are incredibly effective. However, Abdul has his own ads as well. Yeah. Talked to Donovan McKinney, 2 days ago, a couple of days ago, as well about his race. He feels confident despite the fact that Mary Waters is moving ahead with her write-in campaign. Will Mary Waters get more than 1,000 write-in votes? That is my benchmark. I don't know if she will.
I don't know. And I want to say something here because it's possibly going to come out. And that is, that we're hosting a forum on July 18th.
Yes.
And everybody who is on the ballot is invited. That's the litmus. If you're on the ballot, you're invited to come and contribute to the forum. So far, Shree hasn't responded. He very well may respond. I know that Donovan is not post saying, "Hey, listen, I want you to debate me."
I'll get Shree to come. I'll get him to come.
Okay. Well, God bless you. Because it seems like what's happening is Mary Waters wants to come because she says she's officially a write-in, but there's no such thing as an official write-in. You just ask people to write in. And there are people who question the intent. She knows she's not going to win.
She knows that. She's smart.
Yes. It's her intent here as a spoiler or to present the kind of arguments that Shree might present without Shree having to show up. Because some people question whether or not there's some type of time. But our decision isn't based on that. Our decision is based on if you're officially on the ballot, you're invited to come. And so we had to say no simply because, that's the litmus. And you don't change the rules because someone says they're officially. And this is not the first time that we've had write-ins when we just show.
And talk about some of that conversation, Donna. I'm not going to wade into the speculation. However, I want people to know what we're talking about when we talk about the motivation behind Mary running. Go ahead.
Oh, God. You're running as a write-in.
Well, I was going to say, Donovan is running against Shree Tanadar. He has the support of not only Detroit's Black establishment, but Detroit's progressive wing. He has the support of all of his legislative colleagues. He has the support of national groups like Justice Democrats, right? It doesn't make sense for Mary to get into this race and to spend her time and money to diminish the ability for Donovan. And that's why I asked Donovan, why have you guys not been able to have a conversation and say, hey, what are your motivations? What would you like? Could I add you to my table? Could I add you to my, that is a little bit sad to a lot of the people that I talk to, like Kamal Clark, who told me it's just confused. I mean, he says, I think Mary Waters has legitimate concerns, and is well within her rights to run her campaign. However, it's just disappointing given the conditions in which Sheree was initially elected. We're repeating them over and over again.
She just got elected to city council as an at-large candidate. Just took office in her second term, I believe, this January. Okay? She has a job. There's only one reason people enter races like this, in my opinion. And I don't care. It's just my opinion. She has the right to run. I have the right to my opinion. And that is that you're trying to be a spoiler. Now, I know you're trying to be a spoiler. Maybe Donovan McKinney wants her in the race to be a spoiler. Maybe Shreetha Anadar wants to be a spoiler. But I have my own suspicions.
I don't think Donovan wants her to be in the race.
I think who could this possibly benefit? Is you taking your council bona fides and using your council bona fides to draw attention from somebody else. I said the same thing about Mike Duggan when Mike Duggan was running for governor. Sometimes you run for races and the only hope for the only victory is that you spoil somebody else's. I don't want to have to play games with myself where I pretend not to know this or not to see this. I think it's dishonest to say I'm going to run. You want to raise issues, raise issues. I want to raise issues, not raise issues all the time. I'm not to raise issues in that way. You have a perch as a sitting city council member to raise every single issue you raise. You have a perch as a member of the Democratic Party to raise every issue you want to raise. After all, these people are not running as independents. But when you choose to enter into a race and you say it's to raise issues, I call foul. You're not. And I think it's important that we be allowed to speak truth. Yeah, you have the right to do whatever you want. It's a free country and free speech. And my speech is this. If you want to run a race, get the signatures and get on the ballot. You didn't get the signatures. You're not on the ballot. You got in at the 11th hour anyway. You didn't get the signatures to get on the ballot. You're not on the ballot. Now it's not your turn anymore.
You know who else didn't get the signatures is Mike Duggan. He didn't get the signatures, and he said it was not his time. The wins are not on Mary Waters' side. She received 34% of the vote in 24 last time she ran against Sheree Tanadar. Sheree is probably going to hope that Mary gets a lot of votes, take it away from Donovan. That East Side Community Candidate Forum is July 18th, the day before my birthday. Is that a Saturday?
Yes.
Yeah, so my birthday's a Sunday this year. That's great. Yeah, you guys are going to have a chance to participate and learn where candidates stand on community issues and our priorities, local policy. We want to unify resident voices on issues that reflect your priorities. This event is being held in partnership with SEIU of Michigan. Please come. If you are a candidate, please join us. I will be reaching out to Sheree Tanadar, Justin Unwenyu, Abe Ayash, Corey Hall, Adam Oye, John Conyers, Ebony Taylor, Arthur Harrington, Arthur Harrington and Anthony Eade and Willie Burton. Excuse me, Willie. I don't know why I forgot your name there. And then the 11th, that's Donovan's current seat, right? That's Kimberly and Michael Howard, right?
Yeah, some other people. So we have invited. We're doing Senate, U.S. House 13, Senate Districts 1 and 3, Michigan Senate 1 and 3, at Michigan House 911.
Awesome.
And we are doing our confirmations. We got a lot of candidates confirmed they're going to be there. I really hope to see everybody there. It's going to be a fair and non-partial kind of conversation where we really want to have people talk about their issues. So it's not going to no gotchas, no kind of crazy stuff. But what is it that you would do in this seat? Yeah. If you're running for office, you should be prepared to answer any questions. We're not giving them away at
There is
you're running for office.
Right.
Yeah, you're running for office, so you should be prepared. We ask hard questions here, but they're not unfair. I'm really looking forward to the event.
Yeah, let's go into our shout outs. We want to remind you guys, if you want topics discussed on Authentically Detroit, please do hit us up on our socials at Authentically Detroit on Facebook, Instagram, Twitter, or our website at authentically-detroit.com. Donna, let's start with you. You got a shout out today?
I do. I want to shout out Bill and Carol Harris for 60 years of marriage and 60 years of cultural impact. We went to an event that was hosted yesterday. Let me see if I can remember the name of this organization. But it was an amazing event. I was really moved by it. There was the Marion Hayden Orchestra, I believe, performed, and some other really powerful people. I had an opportunity to speak to one of my shurels, Dr. Gloria House. But many other people came together. He is a playwright, and she is an interior designer, and also both of them are artists. They are friends of my husband, Kevin, sort of like his mentors, and 60 years of marriage. We're going to be married for 6 in August, but they've been married 10 times longer than us, and they still are very much in love and really, showing, demonstrating what it means to be in love. So I honor them.
I want to give a shout out to my friend, Michael Andre. I've been going to Stott Garden of late and hanging out. Shout out to our other friend, AK, one of Detroit's best DJs, honestly. She's also at Stott nowadays. And so if you guys are trying to find me in Midtown on a weekday afternoon, late weekday, Wednesday through Friday, you might just find me at Stott Garden. Shout out to Michael Andre, Diego, Evan. Shout out to John and Allison downstairs at Wet Picnic, new bar that used to be Sufimoto Castelia. If you guys are trying to get outside of your home this week, Stott Garden is a great place to be if you like to be hot.
Where's located?
It's right there on Alexandrine, across from a restaurant that I don't go to, Mad Nice, and across from Seasons Market. You know Seasons Market.
Absolutely not. I'm just feeling so out of it.
Whatever. It's on Second, right over there near Bronx and all that. So shout out to Michael Andre. I just wanted to give you a shout out, special guy that I have been leaning on and hanging out with of late. And so shout out to you, Michael Andre.
Friendship is everything.
Yeah, it is. We want to thank you guys. We are trying to build a platform of authentic voices for real people in the city of Detroit. Please like, rate, and subscribe to our podcast on all platforms. We'll talk to you guys next week. Thanks so much.